Hello KJR readers, it is a great honor to introduce our study and listen to the authors from KJR Online. My name is Pyeong Kim from Asan Medical Center, and I'm going to present our study entitled Bone Age Assessment Using Artificial Intelligence in Korean Pediatric Population, a comparison of deep learning models trained with health chronological and Greulich-Pyle ages as labels. Bone age is representative index of skeletal maturation. It is commonly used for diagnosis of growth disorder, and also it can guide orthopedic surgery and provide useful information for forensic issues. Greulich-Pyle, also called as GP method, is one of the widely used bone age assessment system using hand radiographs. However, it is questionable that this could be directly applicable to Korean population. Actually, GP method was developed based on Caucasian children with the upper socioeconomic level almost a century ago. Indeed, one recent study reported that contemporary Korean children showed different rates of skeletal maturation compared to GP atlas. In this context, Korean Standard Atlas was developed in 1996, but rarely used in clinical practice due to small sample size and rather time-consuming work. Therefore, time-efficient, deep learning-based bone age predictions model specialized for Korean population are required. Thus, our study was to develop deep learning-based bone age prediction model using hand and wrist radiographs obtained from healthy Korean children and adolescents with their chronological age as the label, and to evaluate its feasibility by comparing with a commercialized GP-based deep learning bone age assessment system. In this study, we included left-hand radiographs of Korean pediatric subjects without known bone development affecting disease or conditions. The detailed exclusion criteria are as follows. After the training session with non-MD researcher and two pediatric radiologists, the researchers screened all identified patients and radiographs based on our eligibility criteria. Simultaneously, one junior pediatric radiologist double-checked radiographs and repeatedly gave feedback to researcher during the screening. In addition, radiographs which were initially deemed to be excluded were confirmed to be excluded or not by consensus between two pediatric radiologists based on the extracted information. Regarding the model development, we first conducted pre-processing, including resizing, background removal, crop, and a series of transformation like translation and rotation. Then, ResNet was trained, combining with success information, which was programmed to predict bone age by 1 month. Internal validation was conducted using four-fold cross-validation. To test its feasibility, the accuracy of our model was compared with that of GP-based deep learning model in two separate external validation sets. Those parameters were used for the comparison, including root mean square error and mean absolute error. We also performed Bland-Altman analysis. And in addition, we performed subgroup analysis restricting subject age like this to minimize potential inaccuracy in extreme ends of age. Let's see the results. Among the 62,113 radiographs identified computerized research, 41,077 radiographs were excluded according to our eligibility criteria. And finally, 21,000 36 radiographs were used for the training. We used two separate external validation sets from the two different institutions, comprising 343 and 321 subjects respectively. And this plot shows the scatter plot between the chronological age and predicted born age by GP and Korean model. Red dots indicate the GP model and blue dots indicate Korean model. As you can see, Korean model seems to be well fitted in the internal validation. This is the results of external validation using the Institution 1 dataset. As you can see, the born age predictions from the Korean model, which are represented in blue, tend to be closer to chronological age than those of GP model overall. And furthermore, both RMSE and MAE were significantly lower in Korean model, and the proportion of cases where the difference between born age and chronological age within 18 months was higher in the Korean model. This is the results of external validation using the Institution 2 dataset, and you can also see that born age predictions from the Korean model tend to be closer to chronological age compared to those of the GP model. In addition, MAE was significantly lower, and the proportion of cases where the difference between born age and chronological age within 6 months was higher in the Korean model. And the subgroup analysis restricted to age of 2 to 16 years for boys and 2 to 14 years for girls. GP-based model showed a trend to underestimate born age before the age of 8 years and to overestimate born age after the age of 8. By contrast, Korean model showed no significant age-dependent bias. There are several limitations of note. Because our data was derived from single institution, it may not be a representative data of Korean children and adolescents. In addition, potentially eligible subjects in radiographs were initially reviewed by a non-MD researcher in a retrospective manner. Some included subjects might have had undescribed endocrinologic problems. In addition, a number of infants, toddlers, and older adolescents in the training dataset were relatively small. And skeletal maturation can vary within the same chronological age. Finally, our MSE of our model was higher than 6 months, which is acceptable range for an accurate born age assessment tool. In conclusion, newly developed deep learning-based Korean born age assessment model trained using the chronological age of Korean children and adolescents without known bone development affecting disease or conditions as label showed better performance in born age assessment than a GP-based model in the Korean pediatric population. Further validation study is required to confirm its accuracy. And thank you for the attention.